Welcome to Diabetes Connections in the News. I'm Stacey Sims. These are the top diabetes stories and headlines happening now. In the News is brought to you by Edgepark. Our top story this week, a new pilot program to allow pharmacists to prescribe continuous glucose monitors. This comes from the American Pharmacists Association Foundation with support from the Helmsley Charitable Trust. The foundation says that while many patients with diabetes may not have access to a primary care physician, the average person interacts with their community pharmacist 12 times more often than their primary care provider. The program will launch in 20 community pharmacy practices across the U.S. There will be a 90-day enrollment period, followed by 12 months of monitoring and management. We will follow up on this. I've reached out to the Pharmacists Association. We're going to have somebody come on the podcast and explain how they think this really will increase access to CGMs. We told you recently about Mobi's approval. That's Tandem's tiny pump, billed as the world's smallest durable automated insulin delivery system. Well, Convatec Group now says they've partnered with Tandem on a new 5-inch infusion set for the Mobi. Not a lot more information than that, but it's interesting because while Convatec makes infusion sets for just about every tubed pump on the market, just last year, Tandem acquired another infusion set developer, Capillary Biomedical. There's a new law in Georgia to make sure all schools have emergency glucagon on hand and that it can be used for any student. House Bill 440 took effect in July. It will allow public and private schools to acquire and keep a supply of glucagon. It allows prescribers to provide standing orders or prescriptions for ready-to-use glucagon so that it can be rapidly administered to students in an emergency. Schools will also be able to work directly with the manufacturer or third-party suppliers to obtain the products for free or at fair market or reduced prices. In 2018, a school nurse in Illinois used one student's glucagon on a different student having an emergency, breaking the law. That law has since been changed in Indiana and now in Georgia. Disclaimer here, the state rep who sponsored this bill, Doug Stoner, is married to my dear friend Trip Stoner, who lives with type 1. I think most of us know this, but good to see research on it. A new study showing skin reactions at insulin pump infusion sites are common among people with type 1 who use the devices and can lead to delivery failure. Researchers at the University of Washington in Seattle used biopsies and non-invasive imaging to compare insulin pump sites with control sites in 30 patients. They found several differences at pump sites in comparison with control sites, including fibrosis, inflammation, a disease-fighting white blood cell, which indicates an allergic reaction. 93% of patients reported itchiness at the site. 76% reported redness. Now, the researchers think preservatives in the insulin or the makeup of the infusion sets are probably to blame, but they admit they don't really understand it fully yet and are calling for a lot more research. Very large new study seems to confirm that the COVID-19 pandemic precipitated a jump in cases of type 1 in kids and teenagers. This study pooled data from 17 previous studies and looked at 38,000 people under the age of 19. They found the incidence of type 1 was about 14% higher during 2020 than in the previous year. The incidence rose higher in the second year of the pandemic, up 27% from 2019. Before COVID, the incidence of type 1 in kids was rising at a steady rate of around 2 to 4% a year. Even though they're saying COVID-19, it's still unclear what triggered the sudden increase and how long the trend might persist. Exactly what happened here isn't known. It's also important to keep in mind that a few researchers have spoken out that they believe the increase sounds implausible. Studies from Finland, Scotland, and Denmark could not directly link coronavirus infections to an increase in type 1 diabetes. But all of the analysis seems to reaffirm that kids with type 1 presented with more severe forms during the pandemic. In other words, the incidence of diabetic ketoacidosis definitely went up from 2019 to 2020. They're thinking, though, this may be because people were hesitant or unable to seek emergency care when early symptoms appeared. Right back to the news in just a moment. But first, take control of your diabetes with a broad range of diabetes management supplies from Edgepark. The latest diabetes supplies and continuous glucose monitors from top brands simplify blood sugar management. Edgepark accepts most insurance plans and Medicare Advantage covers certain devices. Plus, Edgepark takes care of the insurance paperwork to make ordering as seamless as possible. Visit edgepark.com/diabetesconnections or go to diabetes-connections.com and click on the Edgepark logo to learn more about Edgepark's diabetes supplies and CGM devices. Back to the news now, and new research showing the best time to predict childhood type 1 diabetes is ages 2 to 6, when screening detects 80% of future cases. Early screening also leads to more timely treatment, better health outcomes, and less diabetes distress. These researchers reviewed findings that screened 90,000 children under the age of 6, 32,000 kids under 18. These researchers say it's one thing to know screening works. It's another thing to get adoption of universal screening at state government, payer, and healthcare provider levels. By the way, when they say childhood type 1 diabetes, they literally mean type 1 diabetes that presents before the age of 18. Very small pilot study suggesting that kombucha reduces blood glucose levels in adults with type 2. I'm including this because you're going to hear a lot about it. I want you to keep in mind the sample size, too small for statistical significance. A total of 12 people with type 2 were randomly assigned to drink a glass of either kombucha or a placebo daily with dinner for 4 weeks. They then waited 8 weeks with nothing and then switched to the other product for another 4 weeks. The kombucha in this study significantly lowered average fasting blood glucose on average from 164 to 116. By the way, kombucha tea is a fermented drink made with tea, sugar, bacteria, and yeast. And finally, an update on non-invasive glucose sensors. I'd like to keep you up to date because we see these a lot in tech publications, but nothing yet in medical journals. The latest is a blood glucose sensor called Glucagon. It's an RF sensor that you wear on your wrist. It uses the RF radio frequency to obtain signals from beneath the skin. The company that makes it is called Afon, A-F-O-N, and they hope to have the device on the market by early 2024. There is no information available on how well they are progressing with any kind of regulatory approval, but they do say a multi-phase trial will be conducted later this year. Glucagon is designed to be placed under your smartwatch, and then the watch would be part of the monitoring system. We shall see. On the podcast next week, I talked to Justin Eatzer, who you may know better as Diabetic. Justin was diagnosed by TikTok. I kid you not. He found out he had type 1 diabetes through the community. We will find out much more about his story and how he then pivoted to reviewing and reporting on diabetes technology. Our previous episode out this week is about how to talk to little kids about type 1 diabetes without making things scary. My friend Laura Self is a preschool teacher whose daughter was diagnosed at age 8. We reminisced a lot on the show about how we raised our kids, who are now both young adults. I am asked all the time, how did you make Benny so independent? Laura and I have a whole conversation about that. Her daughter spent time abroad as well. I don't know why we let these kids do these crazy things. And that's it for In the News this week. If you like it, please share it. Thanks for joining me. I'll see you back here soon.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.